So, hi, good evening, students. This is Dr. Shubham Mittal this side. I'll be discussing a topic of tumors of larynx today. So, if we talk about our NEET, PG, INSET, and your FMG examinations, if we talk about tumors of larynx, the topics that are more important for tumors of larynx, they are divided into benign and malignant. Malignant is something really very direct. We have divided malignant tumors of larynx into glottic, supraglottic, and subglottic malignancies. What does glottic means? Glottic is true vocal cord. So anything which is above true vocal cord will be supraglottis. Anything which will be below true vocal cords will be subglottis. If we talk about the benign tumors that are particularly important for a postgraduate medical entrance examinations are one is your vocal nodule, one is your vocal nodule, one is your vocal polyp. Then two more important things that are recently being asked is papillomatosis of vocal cords, and lastly, it's the laryngocele. In a crux, if we talk about tumors of larynx, these will be the more important part if we have to discuss the benign and malignant tumors of larynx. There are some other entities also like seromas, fibromas. There are a number of tumors that have been discussed in number of your textbooks. But the thing is, if we are preparing for a postgraduate medical entrance examinations, we have to be very thorough with these topics. First of all, like I'll discuss is cancer larynx or carcinoma larynx, carcinoma supraglottis, glottis, subglottis together. If I'll show you, this is a particular image of carcinoma larynx involving one vocal cord particularly and extending to supraglottis and the subglottis region. This image has been asked. This image has been asked. Remember, this image has been asked in your NEET PG 2019 examinations, and I'll make cancer larynx very simple for you in just a moment. Try to recall the staging of carcinoma larynx. It is very difficult for an undergraduate student preparing for all the 19 subjects and to remember all the stages of carcinoma larynx is definitely difficult. You can see on this chart there are number of T stages given. I'll make it easy for you today. You'll remember this for your life. If we have to remember T1, remember only one thing. Only one name structure is involved. You have to remember only one thing. In T1, it is only one name structure is involved. How will you remember this? Like supposedly the examiner says aryepiglottic fold is involved or arytenoids is involved. Only one structure. If supposedly only one structure is involved, it will be T1. And how to more specify it? If one vocal cord is involved, T1A. If both the vocal cords are involved, T1B. Supposedly the examiner says that there is a patient having malignancy glottis involving only one vocal cord, it will be T1A. If it says one vocal cord along with arytenoids, again there is only one name structure, that is arytenoid, it will be T1 T1A. Supposedly, the examiner says that any more than one name structure is involved. Supposedly, he or she says that arytenoids are involved, or aryepiglottic fold are also involved, or epiglottis is also involved. Anytime, whenever there is more than one structure is involved, it will be T2. This will make your life very easy if you start learning this whole table. If you start mugging it up, you'll definitely forget when you'll reach your what examination center. But if you have to remember, just remember T1 is only T1, one name structure is involved. T2, more than one name structure is involved. And if supposedly question comes like both the vocal cords are fixed or immobile. These are your vocal cords, right and left vocal cords. If they are moving, fine. If they are not moving, they are totally fixed, or they are immobile, it will be T3. Whenever your question says vocal cords are not moving or they are immobile, it will be T3. Or if they talk about anything like pre-epiglottic space or paraglottic space invasion, remember this. T1 is one T1 is only one name structure is involved. T2 is more than one name structure being involved. And in T3, they won't talk about the structures being involved. They'll talk about that the vocal cords are not moving. In T1 and T2, vocal cords are actually moving. But in T3, vocal cords are not moving at all. At all. Fine. And if they want to talk about T4, if they want to talk about T4, they'll definitely use the words invasion of thyroid cartilage. Or I'll tell you something very important. If they use anything, any name other than larynx, if they use any word other than larynx, it will be T4. If that laryngeal cancer extends to thyroid, it will be T4. If it goes above, like larynx, what? Supposedly they are talking like base of tongue, carotid, any word, anything they, anywhere they go other than larynx. If they are saying any word other than laryngeal structures, it will be T4. Any extra laryngeal extension, any neck structure, it will be T4. Fine. I suppose it is very easy if you learn in this method. Treatment, I'll again make it very simple for you. For all T1 and all T2, radiotherapy will be the first treatment of choice, and if it is T3 or T4 staging, it will be total laryngectomy plus minus neck dissection followed by radiotherapy. One thing you have to remember, this is what INICT did in 2020 and 21. They didn't give these options. Supposedly, in cases of T3 and T4, you diagnose the patient as T3 or T4 stage and total laryngectomy is not in the option. You have to remember, go for concurrent, go for concurrent chemo radiotherapy. Chemo radiotherapy. It is not like that they'll give you only the worst one, I mean one best answer. Sometimes there are chances they won't give you one option. There are chances that they won't give you the best answer. They may give you the second best answer in the option only, so you have to choose this one. Supposedly if total larynx in if I mean I'll tell you, if T3, T4 stage is there and total laryngectomy is in the option, you have to go for total laryngectomy. If total laryngectomy or laryngectomy is not there in the option, go for concurrent chemoradiotherapy. I mean, it is very easy or very clear. T1, only one named structure is involved. T2, more than one named structure being involved. In T3, vocal cord would be fixed. They would be immobile, or they'll talk about pre-epiglottic space or paraglottic space invasion. In T4, if they say of any structure, if they're talking about any structure other than larynx, it will be T4. Management treatment T1 and T2, it will be radiotherapy only. T3, T4, if option says total laryngectomy, go for it. If there is no option of total laryngectomy, go for concurrent chemoradiotherapy. Two or three benign conditions that I'll be talking about in this video itself is, one is vocal nodule. I'll tell you something very easy about vocal nodule. Just remember, vocal nodule, vocal polyp. These two terms come, I mean, almost simultaneously. Nodule is bilateral. Nodule is bilateral. It is more commonly seen among teachers like me. I mean, it is, that's why called as the teachers nodule. Teachers have the tendency of shouting. Okay, teachers have the tendency of continuously speaking. For the people who speak more, who shout more, okay, they can develop vocal nodule, and it will be bilateral. Vocal nodule is generally bilateral. That's why it is called a screamers or teachers nodule. This is the image. It is bilateral. Okay, but remember, vocal polyp is unilateral. Vocal polyp is unilateral. The only thing that you have to remember is vocal nodule is bilateral, more commonly seen among teachers, more commonly seen among teachers, screamers, anyone. And vocal polyp is generally common among smokers. For the people who smoke, they have high chance of developing vocal polyp. Another thing is that vocal nodule can be managed by medications, but polyp you have to go for directly surgery. I think, in fact, I hope you liked it. Thank you so much.